Hi, and welcome back to BioBoom, your trusted source for biotech news, market insights, and the science shaping tomorrow. If you're new here, make sure to subscribe and hit the bell so you never miss a deep dive like this. Also, if you want early access to weekly biotech stock picks, FDA catalysts, and exclusive insights, check out the newsletter link in the description. Let's jump in. Over the past month, Sarepta Therapeutics has been at the center of one of the most dramatic stories in biotech. The company is known for its gene therapy, ELEVIDYS, which targets Duchenne muscular dystrophy, or DMD, a rare and devastating neuromuscular disorder that primarily affects young boys. While Sarepta has been celebrated for its innovation, the last few weeks have exposed serious concerns around the safety of its flagship treatment, financial stability, and even its relationship with the FDA. It all started with reports of serious adverse events tied to ELEVIDYS. At least 4 patients treated with the therapy have tragically died, reportedly from complications such as acute liver failure. This sparked immediate concern, especially since the therapy had been approved for ambulatory patients, but was also being administered to a broader group through expanded trials and compassionate use. In response, the FDA requested that Sarepta pause distribution voluntarily. Sarepta declined, arguing that the need was too urgent and the benefits still outweighed the risks. This back and forth marked an unusually public dispute between a biotech company and a regulatory body, and it sent shockwaves through the industry. Eventually, the FDA imposed a partial clinical hold, blocking new enrollment in trials involving non-ambulatory patients, many of whom represent a significant portion of the DMD population. Meanwhile, Sarepta announced a sweeping corporate restructuring. Roughly 500 employees, close to 40% of the workforce, were laid off in an effort to reduce operating costs. This was not just about regulatory response, it was a signal of growing financial pressure. Sarepta is carrying over $1.5 billion in debt, and while ELEVIDYS brought them commercial potential, regulatory uncertainty and reputational damage are complicating the path to profitability. Despite the chaos, some progress has been made. The FDA recently lifted its clinical hold for ambulatory patients, allowing Sarepta to continue treating a narrower group. But serious questions remain. The therapy is still off limits to non-ambulatory patients, and the agency is expected to demand more comprehensive long-term safety data before any expansion is allowed. The situation has also exposed internal conflict within the FDA itself. The abrupt resignation of Dr. Peter Marks, who was involved in the decision-making around Sarepta, suggests there was disagreement even among regulators. That tension, combined with pressure from advocacy groups, has led some experts to question whether ELEVIDYS was pushed through too quickly. All of this leaves Sarepta in a precarious position. The stock has been extremely volatile, at one point surging over 60% after the FDA partially lifted its restrictions, but still well below its former highs. More importantly, the company must now rebuild trust with regulators, physicians, and families who were once hopeful that gene therapy might offer a breakthrough. This moment is about more than Sarepta. It is a reality check for the entire biotech sector. As gene therapy moves from theory to treatment, we are seeing in real time how high the stakes truly are. Incredible promise, yes, but also real risks, real human cost, and the real need for thorough, transparent regulation. Thanks for watching this deep dive from BioBoom. If you found this valuable, make sure to like, subscribe, and share with others who follow biotech news closely. We break down the stories that move markets and medicine. And do not forget, our weekly newsletter drops every Monday at 7:30 a.m. Eastern with biotech picks, FDA watch lists, and exclusive insights. Link is in the description. Stay sharp, stay informed, and I will see you in the next one.